Good evening, Doc. Good evening po sa lahat. Okay, continue na po tayo sa tongue body shape. Okay, this refers to the external form of the tongue. It is also called the tongue form. The normal tongue shape is neither too thin nor too wide. It is soft and supple without being swollen. Its form tapers off towards the teeth. There are no cracks on the surface. So sa clinical significance, the tongue shape is the outward manifestation of the tongue body. It reflects the condition of the sangfu organs. Observation of the tongue shape can provide more information that can be gleaned from the color of the tongue body alone. A change in the shape of the tongue body indicates a more severe condition than if the shape were unchanged. The shape of the tongue body helps provide a correct diagnosis when the color of the tongue body has not changed, especially when the tongue shape is grossly abnormal. Okay, first sa tongue body shape. This includes the tongue size, physical shape, whether there are cracks on the surface, and the length and mobility of the tongue. The tongue shape will mainly reflect whether there is a deficiency or excess condition. The tongue shape will give an impression of the condition of qi and blood, as well as whether wind and dampness are present. The shape of the tongue will also reflect the severity and duration of the imbalance. A pale, wet tongue that has arisen due to yang deficiency is less serious and indicates a shorter duration than if the tongue is pale, wet, and swollen. The swelling of the tongue indicates that the yang is chronically weak and therefore not performing its function of transforming and transporting fluid in the body. So, tandaan po natin yan, mas severe po pag nagkaroon na ng swelling sa yang deficiency. Similarly, yin deficiency that manifests with tongue that is red and without coating is not as serious and chronic as yin deficiency that manifests with tongue that is red, thin, lacking in coating, and with cracks on the surface of the tongue. So sa yin deficiency, mas severe pag thin or nagliit yung tongue and meron na siyang mga cracks. The latter shows that the yin deficiency is so deep-rooted and chronic that it is starting to damage the body tissue. Even though the shape of the tongue is highly significant, it is still the tongue color that is single most important aspect in tongue diagnosis. Observation of the tongue body shape reveals primarily condition of deficiency or excess. It also adds information to the gleaned from observation of the tongue body color. For example, a pale tongue may indicate yang deficiency. However, if in addition to being pale, the tongue is also very swollen, this indicates that the yang deficiency is severe and that it has led to the accumulation of dampness or phlegm. So, pag nag-swollen na ang yang deficiency, there is also accumulation of dampness and phlegm. In this example, the tongue body shape reflects the full condition generated by dampness or phlegm. To give another example, if a tongue lacks coating, it indicates yin deficiency. However, if in addition it is thin, this indicates that the yin deficiency is quite severe. So sa yin deficiency, pag nagkaroon na ng having a thin tongue, this indicates more severe condition. In this example, the tongue body shape reflects the severity of a deficiency condition. To give yet another example, if the tip of the tongue is red, so sa dulo ng tongue, mapula siya, it indicates a heart heat or heart fire, usually deriving from emotional problems. However, if the tip is also swollen, red na siya and it is swollen, it indicates that a condition of heart heat or heart fire is more severe. So tandaan po natin, pag meron ng swelling, the condition is more severe. So here, the pathological changes in the tongue body shape. Changes in the tongue body shape includes its texture, size, and surface. So sa texture, if it is tough, it could be tough or tender. Sa size naman, this could be enlarged, na pwedeng flabby, swollen, or with teeth marks. Or it could be sa size small. Sa surface, we have prickles and fissures. Okay? Sa first, we have the texture. The texture of a normal tongue body should be neither tough nor tender. Identifying the toughness or tenderness of the tongue can help one differentiate whether the pattern is predominantly one of excess or deficiency. The pathomechanism of the abnormal tongue texture. The texture of the tongue body reflects the condition of the tongue muscles and membranes, which require nourishment from qi, blood, and body fluid. A rough tongue texture arises when the excess pathogens invade the body and there is exuberant antipathogenic qi. So malakas yung pathogen and malakas din yung antipathogenic qi. The battle between the antipathogenic qi and the pathogenic factors will be strong, causing the muscle fibers to bulge. So nagbabulge po dahil parehas po sila malakas, which causes the stria to become rough and coarse. Sa tender tongue naman, mostly associated with states of deficiency. So tandaan po natin, pag tender, this is a state of deficiency, while pag rough tongue, excess pathogen naman ang present. If the qi and blood are deficient and unable to fill up or nourish the tongue body, causing the muscle fibers to become thin and atrophied, the surface texture of the tongue will appear tender. Or if the yang is deficient and unable to adequately transform body fluid, then cold damp can accumulate in the tongue and cause it tender appearance. Okay po? So here, pag qi, blood, and body fluid, na-nourish niya, magkakaroon ng normal tongue texture. Pag merong presence of blood deficiency, yin deficiency, damp, phlegm, nag-obstruct, so there is lack of nutrition, magkakaroon ng tender tongue. On the other side naman, pag strong ang battle between antipathogenic qi and the pathogens, magkakaroon ng muscle fiber bulging, so there is a tough tongue. Okay po? Sa toughness, the muscle fibers of the tongue body are rough and coarse. The tongue is striated like red meat. Okay? So sa tough tongue, this is an excess syndrome indicating sa first, we have excess heat. Ang tongue body is red and tough. While sa blood stagnation, there is purple and tough. Sa pathogenesis, there is excessive pathogenic qi, invades and struggles with antipathogenic qi, causing the qi and blood to move upward and the muscle fibers to bulge. Sa tenderness naman, the stria of the tongue are delicate, fine, and smooth. The tongue is smooth like skinless chicken breast. Okay, sa tender tongue, which is a deficiency syndrome. This indicates sa qi and blood deficiency, magkakaroon ng tongue body na tender and dry. While sa yang qi deficiency, ang tongue body is tender and glossy. Sa pathogenesis, qi and blood deficiency can't nourish the tongue body, or a yang deficiency cannot transform body fluid, giving rise to the accumulation in the tongue and the tender texture. Okay po? Sa tongue size, often reflects an individual constitution. If a person doesn't exhibit any sign or symptoms, a large or smaller tongue would simply be a physiological variation. Sa pattern mechanism of abnormal tongue sizes, when the tongue body is overfilled with blood or dampness accumulates in the tongue body, an enlarged tongue will result. A small tongue is caused by a lack of nutrition due to a deficiency of qi, blood, and or body fluid. So, sa qi and blood and body fluid, nag-nourish po siya. So, we have a normal tongue size. Pag merong blood deficiency, yin deficiency, nagkaroon ng lack of nutrition, magkakaroon ng small tongue. While if there is dampness, phlegm, and toxin, magkakaroon ng excess fluid fill, so magkakaroon ng large tongue. Sa flabby tongue, the tongue body is enlarged horizontally. Pag merong damp heat or phlegm heat accumulation, ang tongue body is red. Sa pathogenesis, we have pathogenic heat pushes fluid up to the tongue where they stagnate and accumulate in the tongue. Sa spleen or kidney yang deficiency with accumulation of dampness, ang tongue body is pale, tender with teeth marks. Sa pathogenesis, there is deficiency of yang qi, fails to transform and transport fluids which accumulate in the tongue body. Sa remarks, the flabby tongue may be found in healthy persons, especially in the absence of any other symptoms. Okay po? Sa swollen tongue naman, the tongue body is enlarged, mostly in a vertical direction. It can feel the mouth become difficult to retract. In some cases, cause difficulty in closing the mouth. The swollen tongue is a toxic enlargement of the tongue. Okay? Sa indication, ang pathogenic heat invades the heart and spleen. Ang tongue body is bright red tongue body, possibly with pain. Sa pathogenesis, it pushes blood into the tongue, which causes the swelling. Sa alcohol poisoning naman, ang tongue body is purple and swollen, while sa blood stagnation due to chemical toxicity, ang tongue body is dark blood purple, dark blue purple, or pale blue purple and swollen. Sa pathogenesis, qi blood stasis lead to blood accumulation in the tongue body resulting in the swollen tongue. Sa remarks, unlike the flabby tongue, the swollen tongue is not found in healthy person and always indicates a pathology. So pag may nakita po tayong swelling or swollen yung tongue, this indicates na meron po pathology. So we have to treat or diagnose kung ano po yung nag-cause ng swelling or ano po yung affected. Next, we have the tongue with teeth marks, scallop tongue. The tongue with teeth marks refers to the tongue where the indentation of the teeth are visible along the lateral and anterior edges of the tongue body. Sa indication, if there is dampness, the tongue body is pale and moist. While pag may spleen deficiency, the tongue body is slight and pale. Sa pathogenesis, in both cases, water or dampness stagnate in the tongue, which causes the tongue to grow wider, leading to the edges being compressed by the teeth. Remarks, the teeth marks may also be seen in the healthy person. So pwede rin kahit nakakita tayong may teeth marks, this could also indicate na pwedeng hindi naman po siyang or wala siyang problema, and this could be a normal or healthy person. So another table, comparison between flabby with teeth marks and swollen. Sa tongue body enlargement, yung flabby +1 or pwedeng enlarge, yung teeth marks enlarge, and yung sa swollen is ×3 na enlarge. Sa next, yung teeth marks naman, sa flabby pwedeng present or not, while sa teeth marks ×3 na present ang teeth marks, and sa swollen it could be present or not. Sa vertical thickness, ang flabby is present, and with sa teeth marks naman present ang vertical thickness, while sa swollen ang vertical thickness is ×3. Sa horizontal thickness, ang flabby is ×3, while the teeth marks is +1 or it is present, and the swollen it is also present. Sa stiffness of the tongue body, ang flabby is not present, while sa teeth marks, ang stiffness ng tongue is not present, while sa swollen, ang stiffness ng tongue body is ×3. Sa physiological or pathological, yung presence, pag having a flabby tongue, it could present or not, while sa teeth marks, the same, it could be present or not, while having a swollen tongue, this could be pathological ×3. Sa indication naman, yung flabby and teeth marks, there could be a damp phlegm with or without spleen and kidney yang deficiency. While sa swollen, this indicates that there is a presence of heat, alcohol, toxin, and blood stasis. Sa remarks, teeth marks may occur with either a flabby or swollen tongue. However, a flabby or swollen tongue may not have teeth marks. A flabby and swollen tongue may occur simultaneously. Okay po? Next, sa thin and small tongue. The tongue body is thinner, vertically and smaller, horizontally and vertically than normal. Pag thin, this indicates that there is a qi and blood deficiency, yung tongue body pale and thin body with thin coating. Sa pathogenesis, when qi and blood are deficient, the tongue body lacks nourishment and becomes thin. Sa small naman, this indicates that there is a yin deficiency with heat. Ang tongue body is red and thin, small body with little or no coating. Sa pathogenesis ng small tongue, when there is a deficiency of yin, the tongue body is underfilled, and thus the tongue size will shrink. Sa remarks, a thin or small tongue without other complaints may prove to be congenital or not indicate a pathology. Okay po? So tongue surface of the tongue should be moist, relatively smooth, and have neither prickles, ulcers, nor cracks. Sa pathomechanism of abnormal changes of the tongue surface. When the surface of the tongue body is inadequately nourished by qi, blood, and body fluids, crack may result. The two etiologies are heat, which endures the blood and body fluids, and the other one is dampness, which obstruct the outward flow of qi and blood. The pathogenic heat can also push the qi and blood upward, where they overfill the tongue body. This causes the papilla to thrust outward and appearance of prickles. If the pathogenic heat putrefies the muscles, there will be ulcerations. Okay, here, pag mayroong dampness, this would obstruct and magkaroon ng blood and yin deficiency. And pag may lack of nutrition prevents nourishment of the tongue surface, magkakaroon ng cracks. Pag there is present of heat, ganun din, makakonsume, magkakaroon ng blood and yin deficiency. Sa presence of heat, heat forces excess qi and blood into the tongue surface. So magkakaroon ng spicules and prickles. Pag normal tongue surface, nag-putrefies ang flesh with the presence of excess or deficiency heat, magkakaroon ng ulcerations. Okay po? Okay, next we have the tongue cracks. These are obvious cracks on the surface of the tongue which are not covered or filled with coating. The size, depth, and shape of cracks vary. They may be found over the entire tongue or be restricted to the anterior or central portion or the lateral edges of the tongue. Okay, sa indication, this could be excess heat or deficiency syndrome, pwedeng yin deficiency, blood deficiency, spleen qi deficiency with dampness. Sa tongue body, ang excess heat, there is deep red and yung coating is dry coating. Sa deficiency syndrome, yung yin deficiency may red body and no coating. Sa blood deficiency, the tongue is pale or slightly red. Ang tongue coating is buried. Sa spleen qi deficiency with dampness, ang tongue body is pale, flabby with teeth marks, and the tongue coating is buried. Sa pathogenesis, excess heat impairs body fluids or a deficiency of essence, blood, yin, or body fluid, all lead to insufficient nutrition of the tongue body surface, which causes the cracks. While sa spleen qi deficiency with dampness, ang pathogenesis, damp accumulation in the tongue body obstruct the fluids and blood from nourishing the tongue surface. Sa remarks, cracks in the tongue will occur in 0.5% of healthy people. In this case, there will be no complaints. The cracks are not deep and they'll persist on the tongue unchanged. So, sa healthy people, pwede rin magkaroon ng cracks yung tongue. Okay po? Sa tongue spicules and prickles, there are spicules or flat or prickles raised on the surface of the tongue that look like turns on the skin of a strawberry. Spicules look red, white, or black, while the prickles often look red or black. They both tend to appear on the lateral borders of the tongue that can be found scattered over the entire tongue. Okay, yung indication, pag meron toxic heat, yung tongue body is bright red, tongue body. Yung tongue coating is yellow coating. While sa heat in the nutritive or blood level, yung tongue body is deep red, red, or dark purple prickles. Yung tongue coating is little or no coating. While sa damp heat accumulation in blood, yung tongue body is magkaroon ng red prickles and yung tongue coating thick yellow coating. Sa pathogenesis, prickles or spicules are formed when the papillae enlarge. Pathogenic heat pushes blood to excessively fill the fungiform papillae. Sa remarks, spicules flat are generally considered to be due to blood stagnation, while the prickles, yung raised, prickles are most likely due to pathogenic heat. Okay po? Sa tongue sores naman, they vary in size. They can form a yellow head. After some time, they erode and create ulcerations. The area is red and painful. First, we have the heat toxin in the heart channel. Yung tongue body is red, yung tongue coating is yellow. While sa deficiency heat rising up from the lower burner, ang tongue body is red with fissures, ang tongue coating is scanty yellow. Sa pathogenesis, heat toxic or deficiency planes upward, accumulates in the surface of the tongue, and then putrefies the tissues. Sa remarks, yung heat toxin in the heart channel, meron siyang sores, have yellow dimples. In time, they erode and create ulcerations. They are red and painful. Whilst a deficiency heat rising up from the lower burner, sores do not protrude from the tongue, the red color and pain is relatively mild. So tandaan po natin pag presence of heat toxin, they are red and painful, while sa deficiency heat naman, red ang color, while the pain is relatively mild. Okay po? So thank you po for your attention.